Millions of dollars are going to be coming to Cleveland to address health disparities in the city. It's called the Achieve Greater initiative, and it's spearheaded by Case Western Reserve University and University Hospitals and is expected to be transformative. Marissa Sines explains how.
Look, this is just a small step in the direction of trying to address this very complex problem.
Complex issues that reside deeper than the surface of the skin. Medical issues. They often get roadblocked by socio-economic challenges we face, especially for underdeveloped areas in Cleveland.
If you will, as well as a large population of patients who are really traditionally disadvantaged from every sense of the word.
That's why over $18 million split between Cleveland and Detroit has been given by the National Institute of Health to close a gap, specifically for the African American communities.
One cannot address health holistically unless you start to address all the other components of the puzzle.
Dr. Sanjay Rajagopalan, chief of cardiovascular medicine at University Hospitals, is spearheading how the money will be distributed.
One of the major drivers of non-communicable diseases, and we now live in the era of diabetes, obesity, cardiovascular disease, and cancer.
According to numbers from the CDC, up to 500 African American Northeast Ohioans over the age of 35 died of heart disease between 2017 and 2019. For those older than 65, between 1,200 and 1,400 died. Rajagopalan says preventative measures won't just come with writing a check.
But it's finding them the resources that they need to solve some immediate problems. Get them to see a physician or a mental health worker if they need to.
Working alongside Rajagopalan is Jeff Patterson, CEO of the Cuyahoga Metropolitan Housing Authority.
Targeting these specific type of services in our communities, I will say it's a significant percentage.
Patterson says these resources are lifelines to ensuring that deadly disease is not only caught early, but to keep people healthy.
May help save off some of these problems that have traditionally just plagued our community. Invest in their longevity and invest in trying to make them be able to have successful lives.
Yeah, Rajagopalan told me medical institutes in Detroit sought to work with Cleveland. They determined that by reflecting on how socioeconomics played into the rate at which people living in those conditions were getting ill or even worse, dying. And this money is already being distributed. Betsy.
Certainly needed in the community. We appreciate having it. Thanks for the story, Marissa.